And good afternoon, everyone. TJ Alds of I-45 Now and Galveston Now, along with Dr. Philip Keiser. He is the local health authority for Galveston County, as well as the interim CEO of the Galveston County Health District and Coastal Health and Wellness. We come to you on our new schedule now, Tuesdays at 2:30. We appreciate you adjusting your schedule, Dr. Keiser, with us each week. And we are going to try to keep this up every week now as we go through this latest surge with COVID-19, just at a time when we were talking about trying to morph this show and not only just COVID-19, talk about other health issues, which we will. And if you have questions, you can post those in the comment question section, and we'll bring them up to you. I just want to, get the latest up, and I will bring up the C-Track stats. That's the organization that tracks the hospital capacity that we have here going on. So folks log on, and this is looking at Galveston County right now, where it is showing, at this point that the numbers keep going up as far as number of people in the hospital and the ICU capabilities going down. You and I were just talking to this before we went on the air, how some of this is just maybe not about space capacity, but staffing capacity, which is just as much as important. I wonder if you could address that here right off the bat, so people can understand. We're not just talking about the number of rooms available. You have to have the staff in order to manage those, correct?
Yeah. It's really all about the nurses, and that there needs to be sufficient nurses to take care of people while they're in the hospital. And you need a lot of nurses to take care of sick people because there has to be a nurse there 24/7. And when people are really sick, that nurse may end up with just 3 or 4 people as their primary people to take care of. So at least at UTMB, they have beds, they have ventilators, they're doctors, but the concern is that if those numbers keep going up, there will not be enough nurses. There are today, so things look okay as far as that's concerned, but right now there's really a mad scramble to try and get more nursing care.
We're also taking a look now, too, at, let me bring this up. This is the ICU bed usage right now. This is a number of beds in use, and this is Galveston County only. So we're talking about UTMB Health hospitals in Galveston and Lake City, and the HCA hospital in Texas City here. Can you tell us, it's showing 34%. What does that mean? And in red, it's showing that the trend is going in a different direction. But I wonder if you can, it says this is number of COVID in the ICU beds, suspected and confirmed there. Can you give us a number of what we're looking at so for somebody can take a look at it?
Right. So basically what you're seeing is that the numbers red going up, that's the percentage of COVID cases. And ideally, the number of COVID cases in the ICU is 0, right? And it's important to track how many ICU beds are filled with COVID cases for 2 reasons. One is that they tend to stay in the ICU longer. The average person, if he gets in the ICU, it's usually because they've had some surgery done or they had a heart attack or something. And they may be in the ICU for a couple days at the most. But people with COVID can stay for weeks. And then secondly, also the rate of increase shows how much strain it's putting on the ICU. 30% in the ICU is awfully high.
And when you say 30% there, what would normally, let's just take COVID out of the play. At this time of year, summer, we do see a lot more, traumatic injuries, those type of things, because folks are out and about. And so the ICU bed usage goes up during that time. Anyway, what would that number normally be if we took COVID out of the equation?
Oh, I honestly don't know the answer to that. That's a good question. But again, it goes back to not only just what would it be, but also how many. I think another measure is how often does a place go on bypass. And, for the past, 4 or 5 days or so, UTMB has been not taking any transfers. And, it's a referral center for the whole region. But people have been wanting to transfer lots of patients, including lots of COVID patients, and there's simply no room to accommodate them.
And as we get in, and thanks for the questions coming in now, you've given us an interesting chart of things last week showing risk versus, of contracting COVID and being sick from COVID, making your update, when you get in of whether or not somebody's less likely, I mean, more likely to be on a ventilator in the hospital from that. Are those numbers still kind of holding from what you look at? I know that's it's a kind of an ever changing thing. Are they holding pretty much as you saw?
No, it's still of the people in the hospital, 99% of them are unvaccinated individuals, and so that really is holding up. We are seeing breakthroughs. We're seeing more breakthroughs as the numbers go up. In some ways, that's not unexpected. Because even in the clinical trials where the vaccines were approved, they had some breakthroughs, right? I mean, they had people that were vaccinated that got infected. But what we're seeing now is that, as we're seeing hundreds and hundreds of people getting infected, it shouldn't surprise us. I mean, every day, hundreds of people every day, thousands of people getting infected. It shouldn't surprise us that some of them have had vaccine. The most important thing is that the people that have vaccine are less likely to end up in the hospital, and they're much less likely to die, and by factors of 70, 80, 90 times. So if you've been unvaccinated, and if you get COVID, you're playing with fire. So, it's time to get vaccinated. We're seeing this thing spread faster than we've ever seen anything spread before.
In fact, that goes to the question I was going to allude to there is, are unvaccinated people putting vaccinated people at risk, and how much of a risk there?
Yeah. The short answer is yes, and how much we don't know. The real thing that we worry about is that if enough vaccinated people get infected, then at some point, some of these viruses that come out of these vaccinated people are going to be resistant even to the vaccine. And then we're back to square one, and everything we've done is for naught. So that's why it's so important that we increase the number of people that are vaccinated. And it's so important that for vaccinated people to wear a mask. I mean, you're not only doing it to protect yourself, you're doing it to protect your family if you get infected, but you're also doing it to protect the community at large.
And viewers, we will be taking your questions here a little bit. I want to cover some basic topics right now. You had just mentioned that 95% of those in the hospital right now, and this is UTMB numbers, and this was released by UTMB last Friday. I should point out. I'm going to blow this up here so it looks a little bit more. The patients that are in there are 60% of them are younger than 50. And this is since June 23rd. And then as of last week, roughly, this graphic came out Friday. So it's going to be up to that date there. But while we've heard a lot of talk about breakthroughs, and I'm seeing already in comments from here, the vast majority of those making the hospital with COVID-19, 95% are unvaccinated.
That's right.
That's the bottom line number.
That's the bottom line. And the other thing is people think that, well, I'm not old, it's not going to happen to me. But what we're saying is that younger people are ending up in the hospital. Our biggest group in the hospital is between 40 to 60 right now, and we're seeing some 20-year-olds on ventilators in the hospital. We're even seeing some kids under age 10 in the hospital. So this is shifting into younger people. And so this idea that it only affects the old people, I'm going to be fine, that's just not true.
Have you been seeing a surge in the requests for vaccinations now? As we've talked, we've seen some talk nationally about that. Are we seeing that also on a local level as well? People saying, well, now it's time for me to get vaccinated. Oh, let me go ahead and get the vaccines, or one of the vaccines. Are we seeing an increase in that right now?
We're seeing an increase, but I would hardly call it a surge. I mean, we're seeing the numbers increase on a weekly basis by hundreds. And so that's the good news. But it's not at the level that we need. The other thing is that we clearly see it in specific areas. We've just finished this morning a zip code analysis of where we are. And basically, particular areas that are concerned are around Hitchcock and Santa Fe. Very few people vaccinated, only about 40%. And we really need to get more folks in those areas vaccinated.
And what efforts are being made? We've talked about this, more community efforts versus the mass vaccination. What is being done to target those areas? You had mentioned even too, though, that in some places that the calls have been made, said, hey, we'd like to offer the vaccine through your organization, and you're getting resistance from people. Can you talk about what efforts are being made and what's it going to take to kind of break that loggerhead?
Well, I wish I knew what it would take to break the loggerhead, because we would do it. But what we're doing is we're actively hiring people to go out into the communities and build relationships and find those people that would be either interested in at least talking about getting vaccinated or actually doing the vaccines. The important thing to realize is that what we're doing now with vaccines is that we're kind of just chipping away and little by little, but it is working. I mean, where this week we got up to 60% of the eligible people in the county with at least one dose in their arms. And so that's the good news. That's the glimmer of hope. But that took us almost 3 months since we ended up doing our mass vaccination at Walter Hall Park to get there. That was May, June, and July. So it was hard work. And it's going to continue to be hard work, but we're hiring people to go out into the communities. We're reaching out into the communities. I just got off a call with a group of pastors. I've gone to some churches. We've had other people who've gone to churches. We go to community groups. We're going to be talking with school superintendents later next week. Our nursing staff just got off the phone with school nurses. And anybody that's willing to talk to us, we're willing to talk to. And if people have questions and concerns, we're willing to talk to you about your questions and concerns and address them so that you can feel more comfortable about it.
In fact, if you're just joining us, Dr. Philip Keiser, the local health authority for Galveston County, is on. We're talking about the latest in COVID-19. We'll be back. We're going to take a look at the county trends, the more recent ones happening in Galveston County as it relates to COVID-19. That's coming up after this word from the Galveston County Health District.
Hi, I'm Christina Garcia. I'm the Patient Services Manager at Coastal Health and Wellness. I want all Galveston County residents to know that the open enrollment for the healthcare insurance marketplace is now. At Coastal Health and Wellness, we understand the importance of having access to high quality health care. And we understand that the application process can sometimes be stressful, trying to figure out which plan is best for you and your family. So we have certified application counselors that are waiting to walk you through the process. There are 4 categories of plans to choose from, and our counselors will help you through the process. All the plans will cover essential health benefits, pre-existing conditions, as well as preventive care. So what do you need to know, Galveston County residents? The time to act is now. If you need assistance or if you have questions, call us. At Coastal Health and Wellness, we're here to help you.
And again, open enrollment ends here on the 15th of August to give you an update on that. So let's go ahead and get a couple of questions in with some of what we have, and there seems to be while limited, we get the questions about what vaccine brand when we're seeing breakthrough infections. Has there been one that's performing better or worse, for the lack of a better term, on those breakthroughs that we're seeing right now?
Yeah, I mean, it's really hard to tell, and the reason why it's hard to tell is because in this county, we did mostly Pfizer, and so most of the breakthroughs are in Pfizer. And I can't say that we see a difference in terms of the rate, and nationally it hasn't been reported that any one vaccine is more likely to have a breakthrough than another.
Here's a question that comes up a lot, and thanks to Tina Butler Kennerly. If a vaccine develops antibodies, why do I need it if I have antibodies already naturally from having COVID, meaning it?
Yeah.
Last February. Now that's last year, but we get that question a lot. And in fact, there are many folks that say, no, I've already had COVID, so I had the antibodies. Can you explain with that? Because that comment comes up a lot.
The time. Right. So it's a good question. And the answer is that the natural infection does give you some protection. And, we have data here in Galveston County. There's national data now that suggests it gives you some protection, but it's not quite as good. So if you were infected with COVID, then you're about 5 times more likely than someone who's been vaccinated to get COVID or to get sick from COVID, end up in the hospital. But on the other hand, if you've never been vaccinated, you're about 70 or 80 times more likely. We talked about that a minute ago. So what does that mean? That means that, for someone like you, I would encourage you to get vaccinated, because it's going to get you that extra distance. But you're better off than somebody who has never been vaccinated. But if you look at that and say, okay, I'm willing to to take my chances. I can't argue too much about that, but I would caution, say, if you have family members who haven't been infected, you should get them vaccinated right away.
And then it gets into this. The question comes up: are you seeing the variant? Thank you, Deanne Hunt. How are you seeing this variant affect younger populations? We just talked about right now the hospitalizations. A lot of those are 40 to 60. Now, I'm not so sure that, in the past we talked about a little bit older than that. But as you're talking, I'm going to bring up our dashboard for Galveston County so we can look at things here. But where is that as far as, where are we seeing now trend wise on the age population of those who have that are testing positive, and more importantly, who are having serious illness? It's one thing to test positive. That doesn't mean you're going to get sick. In fact, we're seeing a lot of asymptomatic infections, even though someone tests positive. And that's not what we're focused on. Just because you test positive doesn't mean you're sick. But it's more of a, hey, can this go to somebody else? Can it get them really sick and into the hospital? But on the age breakdown, what are you seeing as you take a look at this?
It's getting younger and younger every week, and there's reasons for that. So just if you look at who's been vaccinated the most in Galveston, it's basically people that are over 65. Over 80% have been fully vaccinated. I mean, that's just amazing that we've gotten to that level. And then as you get younger and younger, there are fewer people that have been vaccinated. And then when we look at 12 to 18-year-olds, which is the youngest population that we can have vaccinated, we're only about 25% of those people being vaccinated. And we've got all their younger brothers and sisters who haven't been vaccinated at all, because there is no vaccine available for them at this time. And so what we're facing is that the large majority of people that are unvaccinated tend to be younger. Now, with that, anytime you have younger people, it doesn't mean that they're never going to get sick from it. If you get enough of them infected, some of them are going to get sick, and that's what we're starting to see. We're starting to see them in the hospital. We're starting to see every now and then some in the ICU. This is getting serious, and it's getting very serious because at how rapidly it's spreading. This thing is spreading so much faster, and it's summertime, and kids are out, and they're going to camp, they're going to cheer camp, they're going down to the beach on Slitterbahn, and everybody's on top of each other in some of these places, and it shouldn't be surprising that we're seeing a lot more COVID among kids.
Now, this is total cases, we should point out, what you're looking here, your bottom right hand of your screen here, total cases since March of last year. But what we're seeing is this kind of trend upgrades, particularly in that 21 to 41 year age brackets there, of those cases going up. That, is where a lot of concern comes in. I'm going to switch that from positive cases overall to active cases. And this is the number of folks right now. Again, this is positive numbers, not necessarily sick or in the hospital. We're going to take a look at these here. But of the active cases, there's 1,400 men, 1,600 women right now in Galveston County who are positive. And as you take a look at those numbers, as you had pointed out, 61 and older, fewer cases there all the way through. Even the 56, 332, while still somewhat high, it is, not, by comparison, those 61 to 70, 184 cases, those 71 and 80, 106. Going now, taking a look at things, the 21 to 30-year-old bracket, 580 of those cases are in that age bracket. 31 to 40, 592 of those cases. So that's 1,000, more than 1,000 cases right there, close to 1,100, or a little more than 1,100, that are in just that 21 to 40-year-old bracket alone. They're making up a good chunk of the active cases there. Without breaking down the numbers here, looking at that, how many of those folks are you saying are unvaccinated versus vaccinated?
Oh, almost all of them are unvaccinated. And, you look at those numbers, right? So that's Of the active cases there, you've got about 3,000 active cases. Since this whole thing has started, we've only had about 400 and change people who have broken through overall, period. Okay, so it's a minority. It's not even 10% of the current active cases. That's ever since we started vaccinating. And if you look at the percent of people that have had breakthroughs compared to vaccinated people, 400 some people out of about 180,000 people that have been vaccinated. So what that says is the vaccine works and it's doing its job. And occasionally people get infected, and rarely they get sick. And we've had a few deaths in very elderly people who have had the breakthroughs.
And let me kind of clarify something here. Rosalind Muir is saying, did I hear you right? You plan to go to community outreach, educate, etc., to get vaccinated. She says that's not acceptable. If they want it, they should come to you. I'm confused by this. No one's being forced here. They're just, hey, we're going to go in your community if you want to come. It's not about going necessarily door to door. Hey, we'll come, although that is an option. But this is about going to like churches and the like to make it easier for folks to get there. No one's being forced to get the vaccine, correct?
Yeah, no one's being forced to get the vaccine. And this is America. You have a right to say no, and we have a right to stand on a street corner and say, hey, y'all got to get vaccinated. The First Amendment's still there, and that's all we're doing. And we're asking people, we're not forcing our way into any places. We ask people if they would be interested in having us come and speak to them. And when they say yes, we gladly do it. We're not sending people out to knock on doors and to kick doors down. We're just trying to persuade folks. And I can't think of anything more American than that.
Yeah, than executing that right out. So Tammy Nevels has a good question here. If a person is still affected with COVID, if they quarantine for 10 days after the symptoms are gone, this is going to be someone who has symptoms and that there's not, we talked about this some last week. What is the criteria used to determine outside of the test that says, okay, you're safe to go, but just for someone trying to figure out on their own?
Yeah, so the rule of thumb is 10 days since you've become infected, plus at least 1 day without fever. And if you had a fever your first day, 9 days later, you're good to go. And if you had 9 days of fever and 10 days, and then you're still good to go. So it's really that 10-day period of time and the fever going away. And then people don't have to worry about spreading it or giving it to anyone else. We don't normally get into this part, but we have a lot of folks coming in. I'm going to let your opinions get out there, folks. This is the kind of the thing that seems to come up every single time. Yeah. We're getting these fights going on of all that. I just wonder, we talked a little bit about this last time about the politicization or this back and forth. For a medical professional such as yourself to have this amount, it's one thing to kind of like, okay, hey doc, I'm not so sure, but one point did medicine become this kind of fire point, or has it always really been that way? We're just now seeing it more often. No, I think this is something different. I understand the frustration. I get frustrated with some of my patients, just for other things. But we don't tell people, oh, you deserve it when you don't stop smoking. We don't tell people, you didn't lose enough weight, so we're not gonna take care of you anymore. I mean, that's kind of the burden that we take when we become physicians. We give up our right to allow any sense of disapproval to come in. Okay, and keep in mind that people who get COVID, they're not criminals, they're sick. And but I also understand the frustration. Sometimes I get really frustrated, and I get frustrated at the anger directed at people like me and doctors when we tell people that you should get vaccinated or you should do this, or we're trying to get people not to get infected. I mean, I wouldn't be a very good doctor if I told somebody who had diabetes that they need to change their lifestyle, right? And you wouldn't want to come to me, right? You want a doctor that's going to tell you the truth. My own doctor, part of the reason why I picked her is she's tough, and she's tough on me, and I respect her for that. And And if you just want somebody to tell you things that reassure you, then as healthcare workers, we're not doing our job. Our job is to tell you the truth, even when it's hard. And so, I understand the frustration, but we've got to get people through this, and we've got to get everybody on the same page. And it's just going to take a long time.
And in doing that and trying to go door to door or in the communities and the like, when someone comes up, I mean, I don't know how many times you've been confronted with this. I know you probably get it more than most. When someone comes up to you and just really what we're seeing with some folks here of saying, you're full of it, you're getting kickbacks from the pharmacy industry and stuff. How do you handle that?
Well, I don't get kickback from the pharmacy industry. I don't get anything for telling people that that COVID is a problem. I'm a public official. I get a salary. I don't get any extra money by working extra hours or doing long things, and it's just kind of the way it is. The hospitals don't get extra money for admitting COVID patients. Actually, they're losing money. That's what they're terrified of. It is conceivable that if UTMB or any of these other hospitals get too many COVID patients, that they could run out of money, and that almost happened last year. And then they can't operate. And so, to say that the healthcare individuals and the healthcare writ large is making money on that, it's just not true.
Kay Scheschler brings up something I hear a lot, and I think it's fair to kind of address this. When you can guarantee us the experimental vaccine won't lead damaging side effects, when you can assure me I won't suffer negatively, I'll sign up.
Yeah,
there's kind of a two part to that. There's no such thing, really. I mean,
yeah, I mean, right.
Anyone.
This is not about a ironclad guarantee. Okay, all right. I can't guarantee you that you get in your car, it's not going to fail. I can't guarantee you that an airplane's not going to crash. I can't guarantee you that somebody's not going to run into you. With vaccines, with every vaccine that's ever been developed, there have always been side effects, and there's no way around that. One thing I can say about the COVID vaccines thus far is that their side effects, and particularly long-term and damaging side effects, have been very, very rare compared to other vaccines. I would say, like the J&J vaccine has probably had the worst side effects, and that's where you see these young women getting blood clots, and these are not simple blood clots in their legs; these are actually blood clots in their brain. I mean, these are devastating types of complication, but it only happened in about 8 or 10 women that we know of so far. And one of the paradoxes of the fact that this thing has not been, quote unquote, fully approved is that this extensive monitoring system has been set up, which we could only do in the 21st century because we have the computers and the internet. And we know more about this vaccine right now than we would have had it gone through full approval. And I know people, they just don't buy it, but it's true, because every little thing that happens, we report. And we let people know, and it's being analyzed and it's being reported, and it's being evaluated in real time. Hey, we're worried about blood clots. Let's stop giving J&J for a week. And a week later, they work through all the systems and they know what's going on. Oh, we're worried about myocarditis in young men. Yes, it happens. All right, but it's only happened in about 1,000 young men so far, and every single one of them got better with just some Motrin. So not bad enough that in the net, we should stop giving the vaccine. The flu vaccine, polio vaccine, shingles vaccine, any vaccine you can name, diphtheria, pertussis, all of these vaccines have a rate of side effects. All of them have a very small number of people that have serious side effects. And so far, with the COVID vaccines, it's actually less than many of these other vaccines.
This comes up with something you brought up a few weeks ago. Marian Perez asking, is the FDA close to approving the vaccine? We finally, I think, did get at least the FDA to acknowledge that they're kind of prioritizing that now.
Yeah.
Of getting it out there. And it goes into where do we stand on that? And it seems part of it is FDA was okay with going with an emergency authorization. And it seemed like the FDA would say after that, they're going to go to the normal process, which is,
Right.
oh, we'll be fine under this for a while, not realizing that the public itself, many, I'm not saying most, but many were saying, well, when I hear that it's approved, then I may consider it. And I actually heard from some very, I'm not talking about radical anti-vaxxers. They were
right.
saying when the FDA says we have enough data now, we can say fully approved.
Right.
But what are you hearing? You've got your ears to the ground on this one. What are you hearing right now?
Yeah, sometime in the fall, I think, will be most likely. I mean, this is driving me crazy, just like everyone else, And they're doing their due diligence. They're being very careful. They're looking over every page that Pfizer has given them for their application and that Moderna has given them for their application. And I suspect that because of the complaints of, oh, it went through too rapidly, I don't want to say they're dragging their feet, but I think they're just really making sure so that way that when they do approve it, they can say that they've looked at everything. But that's a very common pushback, and I know to some people that's really, really important. So I just hope that they do it as quickly as possible because I'm pretty confident it'll be okay.
And full disclosure on this next one coming up, this is Donnie Head. By the way, a personal friend of mine, I should point out, known him for many years. Former captain in the Lamarck Police Department, retired from that, has been working in law enforcement. And he is, and since he's brought it up publicly himself, can acknowledge it. We had both of us have a mutual friend who went online about this the other day. And Donnie says this, oh, doctor and TJ, I wish I could have gotten the vaccine before going through what I'm going through now. 14 days in UTMB Victory Lakes and 8 days in ICU, home now recovering. Donnie, first, I'm glad you're home. I had not heard you'd gotten home yet. So that's good. But here was somebody who just didn't get vaccinated, and he's suffering through it, and now is regretting it. Now, I know there are going to be folks saying, oh, you're pushing this narrative out there. I will say what I have said before. If you can point out to me someone we can verify who's in the hospital right now with COVID-19 who wasn't vaccinated and who will tell us on the record, I'm still not going to get vaccinated, I will go and do the story on them too. So far, that has not happened. I just want to make that abundantly clear. I'm not trying to preach or tell anyone what you have to do. I have no problem giving a voice to someone like that at all. But when this comes up and people think it's pushing a narrative, I didn't ask Donnie to send anything in. As I said, I wanted full disclosure. He is a friend of mine. We've been friends for many years, just for me covering him. But you're hearing more and more of this type of sentiment as well right now, are you not?
Sure. And Donnie, I hope you feel better. And I'm sorry you're in the ICU. I mean, that's a miserable experience being in an intensive care unit. I will say, I guess I have two comments on that. I mean, the best time to get vaccinated was in January. The second best time to get vaccinated is today. I mean, really, it's, we can't change the past. We can't undo anything. But, if you haven't been vaccinated, we've got plenty of vaccine that we can do you right now.
And again, Donnie, glad you're home. It's a good one. Glad you're watching too here today, although I wish you were at work and not having to watch. I just want to kind of point this out, folks, and I'm sorry. I try not to get on a soapbox too often. Being a doctor doesn't mean that you have the knowledge of infectious diseases. You could be like a Dr. Death rolling up. Let's just kind of point out something real fast. Dr. Keiser is an infectious disease expert.
Right. Yeah.
All right. This is not just some random veterinarian or dentist. His wife is a dentist. But he himself is an infectious disease expert. Yeah. This is his game. If you want to, not game, but this is what he does for a living, and was at the forefront of the AIDS epidemic as well, and should point that out as well. I had to bring that up because it just shows. I think there's sometimes folks just want to say what they want to say without figuring it out first, because we have brought this up.
But let me say something about that, because there are lots of people out there with MDs saying a lot of BS. I mean, and I see it, and I have friends of mine and colleagues of mine or acquaintances of mine saying, well, what do you think about this person? And then there's this one woman who's, she goes, I'm boarded in 3 things. Doesn't tell you what she's boarded in. And, you hear a lot of people who have enough knowledge to sound convincing, but really not enough to know where the areas where they're wrong. And I think that's really important. One of the things that I try to do very much is tell you what I know, and tell you what my opinion is versus what we know is to be a fact, and to tell you where I don't know things. And to me, that is one of the most important marks of a good doctor. If you can't say you don't know as a doctor, or your doctor has every answer to every question you have and doesn't have areas where they say they don't know, you better think about finding somebody else. And when you see these people online and they're talking and they're spewing all this advice, you're right. Check them out. See what their qualifications are. See whether they do understand infectious diseases. See what their history is, and then also see if they have even a little ounce of humility, because this virus has humiliated us many times over, and so much of what we've said and told people in the past has been not right, and that's harmed us, and it's harmed our credibility. And so we all we can do is take what we have today. And all we can do is take that and move forward with it, and try not to repeat the mistakes that we make.
This is the first time we've had this question here. John Broker asks, if you have been vaccinated and exposes someone with COVID over an extended period of time, like a child in your household, would you expect the body to build additional immunity due to exposure? I guess it would be called immunity plus in this.
Yeah, maybe. No, I mean, that's how vaccines work, right? So basically, first of all, you have antibodies, but which are kind of, think of them like fingers, they grab the virus, right? But you also have T cells, which provide memory and then can kill viruses through other mechanisms. And they're the things that basically have the memory. And so typically what happens is, over time, our antibodies to viruses tends to go down. But if that memory's there, as soon as you get exposed to that virus again, it wakes the immune system up and it attacks it very aggressively. So I think that's a really good insight. And I think the answer to that is probably, but we don't know for sure at this point.
And thanks, Rosalind. I appreciate it about the comments. I know Dr. Keiser does too. We should point out, because she says, I enjoy the show well because it's not staged. Questions and Dr. Keiser answers without the Dr. Keiser never knows what I'm going to ask in this show. It is true. He finds out maybe the first two questions when we sign on before we go live. We do talk about and share, hey, what topics do we want to make sure we get to today? But outside of that, we do not, because one, I'm one of those, I don't know what questions I'm going to ask till I ask them. It sounds weird. I've always done that in my career. Because I get questions all the time saying, hey, will you send me your questions in advance? I said, I don't know what I'm going to ask you a week before the interview. And so anyway,
I didn't even know I could do that. I could ask you, what are you going to ask me?
You can't. You can ask. You're just not going to get there. Because my answer is always the same. I said, well, I may have one or two questions, but most of my questions are based on the answers you give me. And on this show, what I'm seeing from our viewers. And we try to, we're not going to get to all of them. I do pick some questions that I think are asking the questions that many people are, because we're having lots of comments here. Obviously, it is something, that we want to make sure we get to, but I'm not going to ask every question that's up here. And there's a lot of these are comments, or they're responding in there. Here's a question Sharon Aaronwort has. It says, if someone's already had COVID, are you seeing repeat cases with the Delta variant?
Yeah, we are. And so, we're seeing people who've had COVID getting Delta variant, and we're seeing that having more often than people who have been vaccinated. But we're seeing breakthroughs with both reinfections, as we call them, if you had it before and get it again, reinfection with Delta, as well as people who've been vaccinated getting reinfected with Delta.
And you've explained this several times too, but what makes the Delta variant more transmissible?
Yeah, so it's all about that spike protein. There's a protein that sticks up. It's called a spike protein because it looks like a spike, and the Delta has a mutation in it that allows that hook to hook onto the nose. It looks like I'm picking my nose. And get into the nose mucosa more easily, and then get into the cells much more rapidly. So there's something about that allows it just to get in very, very easily. And then with that, because there's more virus in your nose, you make more virus, and then there's more virus coming out of your nose, which can then go and infect other people.
And that goes to a question one of our viewers had, and I can't find it right now, but the question one of our viewers had earlier is that they're seeing that even if you've been vaccinated, you can shed the virus and even shed more of the virus now because of Delta to other people around you.
Right.
That's something that's, while not never discounted, but is a little more backed up by data now of seeing.
That's right. Yeah.
It's
Yeah.
even if you've been vaccinated.
So the CDC back in May, when they told people they didn't need to wear masks if they were vaccinated, it was based primarily on that, and that with the usual virus, or what we would call wild type virus, it wasn't coming out of people's noses even if they were infected. But with Delta, it is. And so now they're encouraging people, and we're encouraging people to wear masks so they don't spread it. In retrospect, I think when a history of this is all written, that'll be seen as probably a mistake. They were probably a little too early to tell people that they didn't need to wear masks.
This is a question we haven't had before either. Justin and Angela Morgan, have there been any cases of individuals contracting COVID, recovering, getting vaccinated, and then still having a breakthrough case? We've seen it broken down.
That's a good question. I'm gonna have to look at that
question
to find out. Yeah.
And I'm sure it's very minute compared to based on just the data we know, which is if you've been vaccinated in an infection or infection and then reinfected, those numbers were already lower. But I would call the double whammy. Infected, then you get the shot, and it goes back to kind of that question we had earlier about what I call immunity plus coming in there. So Justin, Angela, Morgan, we're going to work on that and have that. Hopefully we'll have an answer for you by the next show. Krista Tupper asks, when will the vaccine be available for younger children? That's the one. We know the trials have been going. It's one of those things too. We got school around the corner. I know that's what a lot of people are concerned about. What are you hearing there?
Still hearing fall. Heard last week that Keiser was recruiting more kids primarily to evaluate side effects. So I think they were able to show that it works. I mean, that's what they said. Okay, so kind of reading the tea leaves, I'm guessing they need to evaluate side effects more in kids, and that's what the holdup is.
And speaking of school, Mary Flores asked, will you be encouraging local school districts to do more than just cleaning up classrooms to help prevent or limit the spread in schools? Do you agree with school districts no longer doing contact tracing or positive cases in schools?
So a couple things. Yes, we are. And what we're encouraging. So first of all, I think there's some things that need to be clarified because there's a lot of misinformation that went out with regard to schools early on. Like schools were not going to tell kids that were infected that they couldn't come to school. That's not true, and both DISHES and TEA have clarified that. And then we are going to be encouraging schools to do contact tracing. And we literally, I don't know if you heard some cheering a minute ago, but that was the meeting with the school nurses where they were talking about the various things about, how to do contact tracing and reporting and things to us. We're also going to be encouraging people to mask. And one of the things we're going to ask the schools to do is, they're saying, well, we're not going to make kids mask if their parent, but I think it should be, we're not going to make kids mask if their parents don't want them to. Okay. So I think as a parent, you have a right, if you send your kids to school, to say, I want my kid to wear a mask, and expect the school to help enforce that. The other thing is that we're not going to be allowing infected kids going to school. And so this is not just a school decision, despite the fact that, that Governor Abbott has put a lot of strictures on what public officials can and can't do with COVID. Most of that really has to do with limiting people moving about. And it doesn't really have anything to do with people that are infected. So those public health laws are still in effect. And so we will be able to quarantine people that kids that are infected so that they don't come to school. And we will even be able to quarantine contacts if necessary. So we're going to be looking at all of those things. And if we have a problem in schools where there's particularly high numbers of cases, we're going to be having all those options on the table and do whatever we have to do to get those case numbers down.
There's a lot of concern. I'm seeing this from a lot of parents right now on our screen, and also just folks who are contacting me about this. Let me just ask you: it is that are schools? You talk about the misinformation getting out or some confusion. Are schools doing enough locally, you think, to lessen the risk considerably? Right
Yeah.
now?
Well, the problem. Let's back up with that question, okay? And the problem really goes to the governor's order and what are schools allowed to do. And the answer is they're not allowed to do very much. They can't have masking as a requirement, right? They can't have distance learning. All right, they have to have school in person. So what does that mean? That means that the distance in the schools for social distancing is limited, right? So but one of the things we've learned over the last year, at least before Delta, was that you didn't need 6 feet, you only needed 3 feet. Well, we'll see if that holds up with Delta virus spreading. So there's not a whole heck of a lot that they really can do. But there are some things they can do, and these are the kind of advice that we give them. One is don't let sick kids come to school. Okay. Do the contact tracing, tell the kids who are exposed that, they need to stay home. Look at how kids go through the school. You can have all these things in place and then suddenly a bell rings and everybody goes out in the hallway all at once. Stagger class times so that the hallways are not filled with kids. Same thing with eating lunch, if you have the space to do it. And not all schools have the space to stagger things so you can spread kids out while they're eating. But we're just going to have to do the best we can. The good news about schools, and we learned this last year, is that schools tend to be reflective of what's going on in the community, as opposed to being the driver of what's happening in the community. Now, that being said, we're seeing a shift toward the younger kids, and that may change. But we're going to be keeping a close eye on it. And if we see a lot of cases in a particular school suggesting that there's something going on in that school, then we'll do what we can and what we have to do to try and ameliorate that.
And speaking of schools, and we'll have more details on this, we are going to be doing an hour-long special in each of the school districts in the coverage area. In fact, starting next week, will be August 9th. It's NFA ISD, August 10th in Friendswood ISD, August 11th in Dickinson ISD. We're getting confirmation from Texas City and Hitchcock on their dates and times. They've both agreed to do it. And then August 19th, we'll be in Galveston. We're also waiting for Clear Creek, and we're going to be spending an hour at each district talking with COVID, leading off with COVID, to talk about what the rules are, what they aren't, what's false, what's not false along the way. So that's going to be a part of it, and we're going to be have some more input from Dr. Keiser on those shows as well. He won't have to be in all of them. He's going to record his part. Yeah, just
thank you.
Yeah, I know. I saw your worried look when I brought your name up there. He said, "Oh my gosh, I have now this to go along with everything else." In there. Jack Pennington has a really good one that Keiser, and I know you're getting sick of this question from me alone, so I'm going to let someone else ask you this question. Do you think those of us who are older and have health concerns will be able to get a booster anytime soon? Also, do you encourage this? Thank you very much. Thank you so much, I should say, for that. Of course, I'm asking about boosters now for 2 months. I'm one of those. I'm ready. I forget the booster. Just give me the full Pfizer shot. That's what I had. Give me the full dose again. I'm ready for a refill. It's the way I look at it. Where are we on boosters right now? So
there's no we're all over the place. That's basically the answer. The federal government has not made any official recommendation. The state basically says without an official recommendation from the feds that you can't give boosters. It would violate your contract. But by the way, we're not checking. So it's happening. And what I would recommend is basically have that conversation with your doctor. There are places around where if you show up, they're not going to turn you away. I won't mention them by name, but you might be able to figure that out. Just do what you think is best. There is plenty of vaccine. Don't feel like that if I were to get a booster, I'm taking it from someone else. That may change, right? We don't want to have a big run and have everybody, we don't want to have 180,000 people show up tomorrow and say, I need my booster, because one, we don't have enough vaccine, and two, we don't have enough way to give it to them. But it was very interesting. Francis Collins, the head of the NIH, was talking about this very issue. And he said, from a public health point of view, it doesn't make a lot of sense to do boosters, i.e. the vaccines are holding up, all right? But for individuals, it may be a different story. So I think depending on your situation, it's worth a conversation with your doctor as to whether they think that you should get a booster.
Here's a question that's somewhat COVID related, because this has been popping up. I know RSV coming in, that there are more RSV cases happening right now, and particularly among youngsters, the symptoms can be very much like COVID in that. And that may be complicating hospital capacity as well. I wonder, and this is, by the way, I should point out, is James Grassmuck, a school board member in Santa Fe. Can you talk about that? Because there's been a push here lately of on RSV, folks being looking out for that, paying attention to it, and knowing what to do about that.
Yeah, no, there have been cases of RSV that are coming through, and we've seen a lot of RSV. We've seen hospitalizations with RSV, and unlike other years, we're actually seeing a fair amount of adults getting infected with RSV as well. So that part is worrisome, which is also another reason why you should get tested. Because if you're an older adult or have risk factors for having a bad outcome with COVID, if you test positive for COVID, we can give you some antibodies that'll keep you from getting sick. On the other hand, if you've got RSV, well, that's a whole different ballgame. One, you don't have to worry about COVID. You don't have to worry about all those restrictions with it. But the chances are you'll be fine, and it'll be good to know that. But in terms of the effect on hospital capacity, the hospitals in the county are able to meet current demands. Okay, and so I want everybody to understand that. Local residents are not being turned away. People going to the emergency rooms are being seen. Ambulances are responding. What we're worried about is that if it keeps going, that may not be the case. Okay, so when you hear about people being turned away, it's transfers from other hospitals and basically being told, no, we don't have the capacity to take you right now. You have to ask someone else. So we're meeting everything that we need to meet right now today. But gotta be honest with you, if things keep going, it's going to get dicey. But we're also planning on it getting worse, and we're trying to get all the resources that we need.
Yeah, we've already heard a lot of experts say it's going to get rougher here in a while. Let's go. I mentioned this earlier, but I wanted to take a look at the trends. Now, I've narrowed this one down starting March 23rd of this year, not March 20, early March of this year. It's actually March 16th of this year to now. Where we saw this is, you can go across the screen here. I'll pop up a couple of spots here where you're seeing the box here. That's April 6th. It was 81 daily positives that day. And then, the trend kind of goes up and down, but nothing, double digits all the way. Then we started seeing it go up here June 19th. We're at 130, keeps going up. July 27th, 270. But we have seen in recent weeks a downward trend. Now, some of this is the data needs to catch up. I know,
right?
It's something we have learned that and that's been something that's been transparent from the health district, is that we will see data catch up at some point. So these numbers will adjust some, most of the times upwards. But what we're seeing on the 7-day average, just a few weeks ago here was 195 was the average over a 7-day period. When there was a daily positive, and that was July 28th. These numbers you're seeing here, folks, where it really drops down, these are going to be data gets added to. Trust me, over the last few weeks. But we are seeing somewhat of a tick down. Is that a positive thing? We get close. Some people are taking this more seriously, or is this an anomaly I'm seeing here right now?
I hope it's getting better, but it could very well be just that it's taking a while for the data to come in. Remember that we get most of our data from UTMB and HCA hospitals, right? That's given us electronically, so we get that the same day it gets reported. But everybody else in the county sends it to us by email. Some people even send it to us by fax. They may not send it to us the day they get it. They may send it to us 2 days later, they get a result back on a Thursday and they don't get around to sending it to us on Friday, we may not get it till Monday or Tuesday. So there's always a lag there. I mean, if you look at it on a week-to-week basis, what you'll see is it's that last week, which we've kind of closed the books on, is much higher than the week before. This week is rising and rising fast. So it's hard to know. A couple bright spots, like I said, we are seeing the number of people that are getting vaccinated increasing. I had to go to Walmart today. I'm seeing more people in Walmart wearing masks. So we'll see. We just have to wait and see.
And speaking of vaccinations, BJ Young came in here. If I choose to get a booster of my own, should I stay with the original brand? This has been something you talk about a lot too. That there are clinical trials going on.
Right.
Mixing and matching.
And not only that, trust me, there have been people in the county that have done that, and we don't even realize it initially until, when they come in and they say, oh, I'm here for my dose of Pfizer. And then so, they get the shot, and then the nurse opens up the reporting system to put their name in and say, we gave them Pfizer. And you see that, oh, they got Moderna, and then they got J&J, and they're having one of each. And so the answer is we don't know. We don't know the answers to any of these things. And that's part of the reason why you're not seeing a recommendation for people to get boosters, And think about it. On one hand, we've got one group of people say it's not FDA authorized, I don't want to get a vaccine at all. And now we have some other folks who are saying, well, I'd like to have a booster, which we don't have really lots of good data, even though it makes sense to do that. And then you have people kind of mixing and matching them, even though we have no data on that whatsoever. So I don't know how to advise people on that.
Yeah,
I can say is if you had one brand, you kind of know what you're getting when you get your side effects.
And that's why I'm all good with, but the cocktail, as we called it a couple weeks ago, may be coming in there. We've talked a lot about schools, but Amber Perchot, and Amber, hopefully I didn't butcher your name there. And this is a director of local child care center. That's the other part that's coming. People have gone back to work now. They need child care.
Yeah.
Those going to be, that enrollment is already increasing. We're seeing that they're going to be transporting kids on. What's your recommendation to them? And she's talking about even like, hey, can we get us all on a Zoom call at least or something? What resources are available to Amber and others who have child care centers? And we should point out just like the larger ones, but also the in-home ones. What resources are available to them through the health district?
So I'd actually go to the CDC website for guidance on child care centers. They've got guidance out there. It's really good. I will say this is that child care centers have not been a huge problem for us thus far. And I remember very early on, we started having cases in some child care centers that if I mentioned their names, you would know them, and basically set everybody's hair on fire. Like, oh my God, we've got a positive kid, but it turns out most of the child care, particularly the bigger ones, have cohort kids by room and a small number of kids, and they don't spread a whole lot throughout the center. So far so good. I like the idea of having something for child care centers. I think we'll go ahead and do that. And we'll see if we can arrange that in the next week or two.
Here's a question. I think we had it a few weeks ago. Didn't get a chance to do this. Tabitha Parks. If you had shingles, will the vaccine cause you to have a breakout?
No, not that I'm aware of. We haven't seen that. And also keep in mind that there's also Shingles Vaccine, which can help prevent people from getting shingles. So we'd recommend that people think about that as well.
They did force me. I would point out, because right in the middle of my Keiser vaccine earlier this year, I was due up from a shingles vaccine. Yes, I'm over 50, so I got to go do that. But they held me off.
Yeah.
And I even joked with my pharmacist. I said, if I get shingles in the middle of all of this, but it was fine. But it was about, not having effect, because this kid learning it. I was, one of the earlier ones once they kind of opened it up. But it was an interesting thing there too. So be ready for that, I guess. That's still be kind of that we're going to be going on too, that folks are trying to learn more because we're safe. So
but let me say something about vaccines and timing of them. So initially it was, you can't get another vaccine within 2 weeks of getting these vaccines. And that's because we didn't know anything about it. That restriction's been lifted because, there are people who did, and all that's been tracked, and there's really no problems. It doesn't interfere with any other vaccine. So I wouldn't let that interfere with with getting your vaccine.
And I want to thank Kathy for this. It says, I guess I'm trusting this source of everybody because you're willing to say we don't know. We don't have information on that point. Not all of our national reports are willing. And that goes to something you and I have both said, that often what we get is these folks that just want to go on these absolutes and say, this is the way it is. You have even pointed out that said, well, I said something here that, now just doesn't hold true because the data has changed. And adjusting that. And that's why we do this show. I know a lot of folks, not a lot, there's actually a minutia of folks who come on our show who try to say we're part of some narrative. As I said, we're not. Dr. Keiser and I don't plot what we're going to say on the show. I mean, quite frankly, when he and I are talking outside of this, we're talking about him playing the guitar, what I'm doing. The only thing that gets close to this is me asking, like, can I cheat and go get a booster shot now? Because I'm one of those.
I'm not going to answer on air.
Yeah,
but anyway.
And you won't answer. He won't answer me on this question because I'm one of those. I said, give me the full dose. I'm ready to go out there. Only because I'm out in the public so much, and I don't want to. I want to take care of it. I did go on a cruise recently, but as I said, I've kept my distance. The one thing I have learned from you that I wasn't doing well a year ago is I don't touch my face during the middle of our interviews, or anything like that. I have my hands stay down the whole time. And so that's gotten better. Reminder, folks, as well, speaking of, we were talking about back to school stuff a little while ago. The back to school bash is happening August the 14th. It's going to be at the Galveston County Health District offices on Emma Lauer Expressway. They're going to have services there for WIC, free kids haircuts, blood pressure and sugar screenings, COVID-19 vaccines free as well. They're always free. Games, face painting, balloons, and more. Plus free backpacks and school supplies while they last. Again, that's going to be at the Galveston County Health District on the 14th from 8 a.m. until 1 p.m. We're going to be out there that day as well, broadcasting live out there, hoping folks to come out there and join us for that. So again, if you want to get vaccinated, you can as well that day. They'll be available for you to come on out. And again, next week we will start up our first shows. We'll be in Friendswood and Santa Fe right off the bat next week to talk about what's happening in back to school and hearing direct from each of the districts as they go through. Before we wind up, any final words from you today, Dr. Keiser?
No, I mean, just for the back to school bash, I mean, this is not just a COVID vaccine thing. This really is to get kids ready to go back to school, and so that's we're going to be offering a full set of services. And if people want to get COVID vaccine, we'll have that available too, as well as other vaccines. So if kids need other vaccines, sports physicals, whatever they might need, and it's also an opportunity to come check out Coastal Health and Wellness if you need a doctor or you need a place to take your kids to go to the doctor. We're open for business, and we want people to know that. And
don't forget that the very next day is the last day to enroll open enrollment too. We've been publicizing that a lot. So that'd be the day to go ahead and do that out there. Something that's popped up when it came in here, volunteers, and speaking of that, Leslie Simmons is asking if volunteers are needed. Please let us know for the event on the 14th. Leslie, give the health district a call. I'm sure the medical corps that helps out with a lot of those things for the health district, we'd be more than glad to hear from you there. So again,
we're all for that.
County Health District will be going there as well. Dr. Keiser, as always, thanks a lot. We appreciate you coming on with us. Again, we'll be back now. It's Tuesdays at 2:30 now when we're during this program, and that'll be coming up again next week. And hopefully, we're looking at some downward trends on numbers when that comes up. So, all right, this final word from the Galveston County Health District, and that'll be it. Thanks, Dr. Keiser. We'll talk to you next week.
Hi, I'm Christina Garcia. I'm the Patient Services Manager at Coastal Health and Wellness. I want all Galveston County residents to know that the open enrollment for the healthcare insurance marketplace is now. At Coastal Health and Wellness, we understand the importance of having access to high-quality health care. And we understand that the application process can sometimes be stressful, trying to figure out which plan is best for you and your family. So we have certified application counselors that are waiting to walk you through the process. There are 4 categories of plans to choose from, and our counselors will help you through the process. All the plans will cover essential health benefits, pre-existing conditions, as well as preventive care. So what do you need to know, Galveston County residents? The time to act is now. If you need assistance or if you have questions, call us at Coastal Health and Wellness. We're here to help you.